I hung up the phone and my boyfriend said, well, what's going on? What'd they say? And I said, well, they don't tell you you have cancer over the phone. So I knew. It's hard to recall exactly what was said after you hear that you have cancer. It's kind of just a whirlwind. I was 27 when I found all of this, so very young as far as breast cancer diagnosis goes.
Almost 40% of people will be diagnosed with cancer sometime during their lifetime. As a side effect of their cancer or its treatment, more than 60% will suffer from severe, long-lasting sexual health problems. Of those who are sexually active, 20 to 30% will stop having sex entirely. Cancer does not discriminate, regardless of age, race, ethnicity, gender identity, or sexual orientation. Intimate relationships are impacted by cancer. Without help, those relationships often end. This loss affects all areas of a patient's life. If the patient has children, the end of a relationship can have far-reaching implications.
When therapy's over and they say, okay, congrats, you're cured, and now we don't have to see you for 3 or 6 months or something to that effect, you're kind of left to your own devices and are able to finally reflect and think about things. And you kind of feel like you're left in the rubble, and now it's up to you to put it back together. And that's probably the time where I felt like I needed the most help, because I felt very alone for a long time.
The quality of life of individuals as they go through a cancer journey is of utmost importance. It's not about treating tumors, it's about taking care of patients and their families. It's about not just focusing on the cancer, but focusing on the entire patient, the physical, the psychological, the emotional, the philosophical, the spiritual, the sexual health of individuals.
Like so many other patients, Stephanie experienced sexual health issues after her cancer treatments. These physical side effects impacted her life.
I really lost a sense of that femininity, and certainly didn't feel like anybody could have found me attractive at that point in time. And then with the therapies, the chemotherapy and specifically the hormone therapy does cause some side effects that are very much like postmenopausal type symptoms, again with fatigue, decreased libido, and like vaginal dryness. So my interest was gone. And when we did have intercourse, it was uncomfortable. So when we weren't talking and then we weren't having that intimate relationship, it really had a pretty significant toll on our relationship.
One of the dimensions of one's whole life from a mind, body, spirit perspective is sexual health. And that's really something that we as physicians have not had a lot of training in talking to patients about. But it's a very important part of overall quality of life.
I wanted to move on with my life and be given the tools to do that. I think that it would be great for healthcare providers at each visit. It doesn't have to be a huge discussion, but at least to bring up the topics and say, you know, we talked a little bit about the side effects as far as the medications go, decreasing your libido and decreasing your desires. That's something that you're struggling with right now. And maybe if the providers can't talk about it during that visit, they could direct you to somebody who can talk to you.
Stephanie is one of those people. Now, as a survivorship nurse practitioner, Stephanie believes healthcare providers simply do not offer comprehensive sexual health care to all cancer patients. Today, she addresses quality of life issues with all of her patients, including their sexual health concerns. But Stephanie is unique. Many healthcare providers don't know how to start the conversation, set expectations, or when needed, refer patients to other specialists who can address their needs.
And if you've never been taught, what are the questions you ask? What are the follow-up questions? What are the issues that help you ascertain whether this is a physical issue, an emotional issue, a psychological issue? Is it related to the cancer? Is it related to the cancer treatment? If you don't know those questions, you're going to feel not competent to carry on the conversation.
The All of Me Project wants to change that for both oncology care providers and their patients. We recognize the urgent need to improve sexual health care through enhanced communication, training, education, and provider and patient resources. We want to eliminate the time and financial barriers to care. Our mission is to provide the healthcare provider community with the tools to comfortably, confidently, and consistently address sexual health with their patients.
I think that my relationship would have been very different from the way that it turned out if somebody would have asked me those kinds of questions. How's your self-image? How's your relationship with your significant other?
So I think it's really incumbent upon us as healthcare providers, especially in the realm of cancer care, to address those issues.
For more information, please visit allofmeiowa.org. You can make an immediate impact for your patients by hosting a half-day conference in your area or inviting our advocates for on-site training. Together, we can provide comprehensive care to those impacted by cancer. Together, we can improve their quality of life.